One of the keys to safely reopening the economy is antibody testing. All the experts agree. Now that testing, it could show how many people have actually had COVID-19, how far it's spread, and who could be immune to getting it. Now there's a lot of ifs in there, I grant you, but just like everything else involved, there is no coordinated national approach to examining antibodies. Now, several areas, including New York, LA, San Francisco, they've done their own testing, but the results, they're all over the place. And now we have the very first nationwide antibody study, and it's not coming from our federal government, but from an unlikely source. 10,000 employees from Major League Baseball, well, they are the subjects, and we're now waiting for the results. A short time ago, I spoke with one of the heads of the MLB study, Daniel Eichner. He's president of the Sports Medicine Research and Testing Laboratory at the University of Utah. Doctor, thank you for the time.
Pleasure. Thanks very much for your interest in our work.
Well, please explain both the project here, both the sample size, obviously, and why it's so important and what you hope at the end of the day to learn.
Yeah, what we were trying to work out is what is the true prevalence of COVID-19 infection in the nation. And so currently we're relying on data that just measures when the virus is in the body at that time. And so we saw a gap in knowledge. We wanted to try to fix where we would say how many people have actually been infected, either knowingly or unknowingly, with symptoms or not. And so we designed the prevalence study, and we were very fortunate to partner with a great organization that had nationwide coverage, and we're going to do about 10,000 samples in our study.
You know, there's been so much, Doctor, of this virus that we still don't know. I mean, you know far more than I, but also some of the suppositions we had from the beginning that it was only the elderly, for example, that could be susceptible most acutely, or this would be predominantly in colder areas. So much of that is wrong. Give me an idea. If you had to have your checklist, that if you could get the answers to those still open questions, what would they be?
Well, I really like to make database driven decisions. And so we need to get data to work out what's going on here. And I can't comment on a lot of parts about the viral infection. You know, our study is very specific, and that's looking at what the prevalence of the infection rate is in the nation. It doesn't draw into anything to do with, you know, does it die off in the heart? You know, what's the immunity look like? You know, the vaccine development. Our study is very specific. We're just looking at what the prevalence rate of antibody positives are in the nation.
Even today, we're starting to see in South Korea, Doctor, that the duration times for those positive tests are longer than anyone expected. There's even questions as to whether you can recontract the disease. How do you know from the testing necessarily, you know, how far along this person may have had it, or is it possible this person could have recontracted the disease? You know, and also, aren't you by definition more sampling healthier people that could be less susceptible to contracting it?
That's a very good point. And I mean, our study really does look at healthy people. These people have not gone through the regular channels that have had symptoms to go through to their hospital, their doctor, and get tested. We're looking at what the population study is of people who have had no symptoms. Have they been exposed to the virus? Have they developed an antibody response? That's what we're specifically looking at. We're not competing with the other data as far as whether there's virus in the system and not at all. We want to know whether other people have been exposed either knowingly or unknowingly and have developed an antibody response. But importantly, you know, the antibodies we're looking at here, I mean, we kind of get a decent indication of when they may have been exposed to the virus, but our study will absolutely not address what that immunity looks like, how long it lasts for, what the duration is, or anything like that.
In terms of the antibody, how far back can your test go to see if somebody had contracted it, let's say, for example, in December or January? How far back can it go to see that actually, yes, you came in contact with COVID-19, even if your symptoms were so mild, if not even imperceptible?
So the technology we're using, we're looking at two different antibodies. One of them actually comes out shortly after infection, for 1 to 3 days after infection, and it might last a week. And the other antibody that we're looking at comes in about 7 to 10 days post-infection, and that can last for a lot longer. So theoretically, if you were exposed back in December or January, we should still be able to see one of the antibodies in this test.
First of all, I think this is a great thing, Doctor, but you know there's people that have already raised questions in the past as to, hey, why have celebrities been able to get tested when the regular person still can't? Athletes also, we saw that in the NBA right after the outbreak first surfaced. This came up as well. When you get the question, which I'm sure you've gotten before, why is Major League Baseball basically cutting to the front of the line?
Absolutely not. They're not cutting to the front of the line. We're utilizing technology that is not redirected away from frontline testing programs. So importantly, in able to diagnose the COVID-19 infection, you need to do the PCR test. We are doing something totally separate to that. There's no competition. We aren't redirecting resources away from that. We saw a gap in knowledge of what the nationwide prevalence would be for this kind of infection, and we used this technology that wasn't getting used anywhere else at the front line. And when you say, why is Major League Baseball involved? They signed up as a partner because they had nationwide coverage, and we specifically wanted the general population. So we're looking at not the athletes. There's hardly any athletes in the study. It's mainly the employees of the clubs, all the way from team owners, all the way down to people selling hot dog and beer at the stadiums during game time, and even spouses included in there as well. So we're really trying to sample the general population for this study.
I'm sure, Doctor, obviously you're coming to your job from a medical perspective, but there has to be, since you got into sports medicine, a fan in you as well. People are dying for sports to come back. And there is this wrestle between how soon should it come back? Should fans be present here? But inherently, isn't athletic competition, especially those that have any contact involved whatsoever, inherently dangerous with the transmission of the disease?
So first of all, I'd say I love my kids more than anything in the world. I want to go back to work. I know a lot of other people around there, they want to go back to work. Our study specifically and look on the prevalence, and we can use this data to drive public health decisions. And so we'll be able to work out when we can go back to work. Sports is just one area of the workforce where people want to get back to. Should people be congregating in places right now? Absolutely not. We don't have the data yet. And all we're doing is we're trying to contribute to the knowledge so people who are making the public health policy decisions have something to draw upon.
And finally, Doctor, because, as you said, the whole point of this exercise is to have data and science to be able to drive our decisions, policy and otherwise, explain to anyone out there who is still minimizing the importance of testing by and large, not just what you're involved with, but overall, that if you don't have the data, you can't really make an informed decision, especially with a virus that we're still learning so much about.
Couldn't agree more. I mean, we need data to understand what's going on here. This is one component that we can contribute to, but there's a lot more research that needs to be done here. And I can tell you right now, I have never seen anything move so fast in the research field. I mean, there's a lot of very dedicated, very bright scientists and researchers working right now to help solve this issue.
That's fantastic. We look forward to the results. And Doctor, I wish you the best of luck.
Thank you very much for your interest. Cheers.
Now, up next, we will lighten things up a little bit. We're going to show you how SNL is handling coronavirus and also how Brad Pitt did playing, of all people, Dr. Anthony Fauci.